Hello everyone, my name is Vaishnavi Amin. I'm 13 years old. Today I'm going to be talking about diabetes and how to prevent it. Let's get started. What is diabetes? Diabetes is a disease that occurs when your blood glucose, also called blood sugar, is too high. Blood glucose is your main source of energy. It comes from the food you eat. The insulin, a hormone made by your pancreas, helps glucose from food to get into your cells. As soon as the sugar is into the blood cells, it is converted to energy for immediate use or stored for the future. What are the types of diabetes? There are two types of diabetes, type 1 and type 2. Symptoms of diabetes. Symptoms of diabetes are increased thirst, frequent urination without burning sensation, feeling tired, unexplained weight loss, blurred vision, mood changes, frequent infections, and slow healing sores. Type 1 diabetes. Type 1 diabetes presents at a young age. Type 1 diabetes occurs because the insulin-producing cells of the pancreas are dysfunctional. In type 1 diabetes, the pancreas makes little or no insulin, so sugar can't get into the body's cells. People with type 1 diabetes must use insulin shots to control their blood glucose. Type 2 diabetes. Type 2 diabetes is more common and usually starts in adulthood. In type 2 diabetes, the pancreas produces insulin, but there is insulin resistance. Insulin resistance is when the insulin is not used by cells properly. Type 2 diabetes may sometimes be controlled with a combination diet, weight management, and exercise. However, treatment also might include oral glucose lowering medications taken by mouth or insulin shots. Risk factors of type 2 diabetes. Developing type 2 diabetes depends on a combination of risk factors such as family history, age, and ethnicity. You can change lifestyle risk factors around eating, no physical activity, and heavy weight. These lifestyle changes can affect your risks for type 2 diabetes. People with diabetes. 10% have type 1 diabetes and 90% have type 2 diabetes. How can you prevent diabetes? Type 2 diabetes can be prevented and reversed by lifestyle measures such as cutting sugar and refined carbs from your diet, working out regularly, drinking water as your primary beverage, avoiding sedentary behaviors, eating a high fiber diet, optimizing vitamin D levels, minimizing your processed foods, taking natural herbs, and most important, no alcohol. Exercises that lower the risk of diabetes. Exercises that lower the risk of diabetes are aerobic and resistance exercise. Exercise lowers HbA1c values, also known as hemoglobin A1c values, by 0.7% in people of different ethnic groups with diabetes who are taking different medications and following a variety of diets. And this improvement occurred even though they didn't lose any weight. Resistance training and aerobic exercise both help to lower insulin resistance in previously sedentary older adults with abdominal obesity at risk for diabetes. Combining the two types of exercise proved more beneficial than doing either one alone. Diets for type 2 diabetes. Diets for type 2 diabetes are vegetarian and vegan diet. They both offer benefits for diabetes management. Low-fat, unprocessed vegan diets improve glycemic control due to its low calorie content. Vegetarian and vegan diets also improve plasma lipid concentrations and have been shown to reverse atherosclerosis progression. Low glycemic index diet. Low glycemic index diet includes foods which are low in sugar calories. An unprocessed plant-based diet is naturally low in glycemic index and helps improve blood sugar control. A ketogenic diet is a high-fat, adequate protein, low-carbohydrate diet. It may help people with type 2 diabetes the most. It helps maintain the glucose levels at a low but healthy level. Remember to try a keto diet with doctor's advice only. Symptoms of low blood glucose. Treatment also might include oral glucose lowering medications or insulin shots or a combination. One of the major side effects of treatment is low blood sugar, rapid heartbeat, sweating, pale skin, anxiety, numbness in fingers, toes, and lips, sleepiness, confusion, headaches, and slurred speech. These are my references. And thank you for listening to my slides presentation.